Good evening, everyone. Once again, welcome all of you in today's webinar, which is series of webinar in collaboration of Homeopathy 360 with Parul University. I am Dr. Alpesh Jaiswal, Associate Professor in Organ Medicine Department at PIHR, Parul Institute of Homeopathy and Research. And it's my pleasure to be your host for this session. Before we dive into today's webinar, today's lecture, I'd like to take a moment to introduce our esteemed speaker, Dr. Mamta Tapas ma'am. Dr. Mamta Tapas ma'am is a professor in Mathematics department at Parul Institute of Homeopathy and Research. She has 21 years of experience in professional experience in homeopathy and around 15 years of teaching experience in homeopathy. She have also administrative experience of 6 years in homeopathy medical college. Dr. Mamta Tapas Madam is the member of Board of Studies at Faculty of Homeopathy, Parul University, and Academic Vigilance member at PU. She is also a PG guide for the PG scholars. She has published so many research papers and peer review journals and international journals also. She is also looking different coordinatorship of NABH and NAC. She has awarded as academic excellence by Parul University in year 2022 and 2023, and also awarded for the best paper presentation at international conference at Goa. Today, Dr. Mamta Tapas ma'am will be sharing insights on healing of wound with homeopathy, a first aid. It is very basic and very important topic for the homeopathic student. We are privileged to have them with us. Let's welcome Dr. Mamta Tapas ma'am. Thank you, ma'am, for coming this webinar series for beautiful topic. Please welcome and over to you, ma'am. Now you can start.
Thank you so much, Alpesh sir, for a nice and sweet introduction as a speaker. So today, good evening to all. We are now there. So just a minute, I will.
Perfect.
Okay. Yes. So today we start with the topic healing of with homeopathy or first aid. It is a very important to uh, know that if suppose if you are having at home the various types of accidents, small accidents are there. So how homeopathy can help to healing the wound. It is our today's topic. So next question. Yes. So today mainly covers the topic that what is the introduction of the topic, then what is wound, what are the types of wound first. So understand basic understanding of the wound is there, how healing of wound occurs, and how homeopathic helps to heal the wound with homeopathy. Okay. So just what is wound actually? The wound is considered as anything that is result of any damage to biological body tissue, such as skin or organ tissues is there. So wound is that where we got dead cuts or the abrasions, all these are there. Then what are the types of wounds are there? Commonly, there are the two types of wounds are there. One is open wound and a closed wound. And according to the type of wound, the healing, the treatment is also depends on the type of wound. So here also for that purpose, homeopathy also has on the types of wound where we are having which type of wound is there. So various medicines are there in homeopathy. So first, it is very important to know what are the types of wound. So there are basically two types of wounds are there. First is open wound and a closed wound. So what are the types of open wound? Actually, open wounds are the wounds with exposed underlying tissues and open to the outside environment. For example, the penetrating wounds are there. So, which are the types of open wound? Actually, types of open wound are abrasions, where we got as a result of rubbing or scraping of the skin against a harsh surface is there. Then the next open wound is lacerations, where these are the deeper cuts caused by the sharp objects such as knife or with edges having the sharp edges. So lacerations are there. Now next to that punctures. These are small and deep holes caused by long and pointed object as a nail or bites or other where you got a deep hole as a puncture. So that are the punctures. Burns, that result from contact with an open flame or strong heat source, severe cold, certain chemicals or electricity is there, and avulsions where this refer to partial or complete tearing away of skin and tissues. So these are the types of wound where we are the open wound are there. So we are having the abrasions, lacerations, punctures, burns, and avulsions. These are the types of open wound actually. So now how the abrasions are there? In this picture, I show that laceration, avulsions, incision is there, punctured with nails or amputation. So these are the types of open wound, and you see in the picture how the abrasions, lacerations, avulsion, incisions, punctures with the nail is there. Okay. Then next closed wound, actually these involve the internal injury without the skin is being broken. So contusion or bruise, a blunt injury that damage blood vessels leading to bleeding under the skin. It causes discoloration and swelling but does not break the skin. That is contusion or bruise. Then hematoma, a collection of blood outside of blood vessels, often result from trauma or impact that causes blood vessels to rupture and crush injury. Occurs when a part of the body is subjected to a significant amount of force or pressure, potentially damaging internal tissues and bones. That are the crush injury. So these are the closed wounds where we got a contusions or bruises, hematoma, and crush injury. So these are the closed wounds. Then next injury type is also burn, where you got the so many burns are there. Burns are the chemical burns, heat burns, or burns caused by the oil or water, hot water falling on the skin. All these are there. Sunburns are there. So first degree burn, there are the 4 degrees of burns are there actually. First degree burn, where a superficial burn affecting only the outer layer of the skin. Symptoms include redness, pain, and minor swelling, that is sunburn. Second degree burn affects both the outer and underlying layer of the skin, that is epidermis and dermis. We know that the skin structure. And the dermis and epidermis are the main two layers of the skin are there physiologically. And that second degree burns, it includes the underlying layer of the skin and it causes blisters, pain, and swelling. Third degree burn, a full thickness burn that extends through all layers of the and into deeper tissue. The skin may appear white or charred, and there may be little or no pain due to nerve damage is there. And fourth degree burn extend beyond the skin to damage muscles, tendons, and bones. These are severe burns and can lead to permanent damage or loss of function. So these are the 4 degrees burn are there. So burn are also included in the wound. Then chronic wounds are there. These are the wounds do not heal properly and persist over time, often due to underlying medical conditions like diabetic ulcers, commonly seen in the people nowadays with the diabetes that occurs due to poor circulation. Especially often the foot is affected. So diabetic ulcers are seen on the feet. Then venous ulcers, actually they are related with the varicose veins. We are having the long standing history, and that is also typically seen in the lower legs and feet, and that is also associated with the poor circulation. So that is also venous ulcers or varicose ulcers are there due to varicose veins. Pressure ulcers, that is a bed sores, which are caused by the prolonged pressure of the skin, typically in the immobile patients. For all of the bedridden patients, we see the bed sores. And artificial ulcer, arterial ulcers caused by the poor blood circulation, often seen in the people with arterial diseases. So these are the chronic wounds. So these are the typical important and types of wounds are there. So basically, why we know that types of wound? So that because we are having the various medicines in our homeopathy, so we can treat that wounds as with the types. If you know the types, so we can use effectively the our homeopathic medicines. That's why it is very very important, or the value where you have to know about the various types of wound. Then next, what is the healing of wound? Actually, healing of wound is very very necessary. A skin wound results from the breakdown of the epidermal layer or integrity. Wound healing mostly means healing of the skin. Begins immediately after an injury to the epidermal layer and take years. Dynamic processes including highly organized cellular and humoral molecular mechanisms And there are the three phases which are very important for wound healing, that is inflammation, proliferation, and remodeling. Any disruption leads to abnormal wound healing. So these are the diagram it shows which are the four stages of wound healing. So first, hemostasis occurs, that stops the bleeding. Then there is a defense is there along with the WBC and platelets are there that are responsible so that they defense and clean up the wound. And then inflammation stage is there next to proliferation that repairs the damaged cells, and the maturation that's strengthening the repair of the wound or the repairing of the skin. So that's why that process includes the wound healing. So that is the process involved in the healing of the wound. And these are the stages. Four stages are important for the healing of wound. So this is only just we are sharing this information so to know for our clinical side or the clinical purpose. We must understood the types of wound, and now we are homeopathically seeing what are the medicines and that are important for injury or types of wound. So, injury as any physical harm or damage to a body caused by an accident or an attack, which may be internal or external in appearance. Okay, so you see in the pictures also where you got this. Now, some of the injury medicines are very, very important in our Materia Medica. So we are discuss today various medicines that is important for the various types of injuries or wound healing, or the types of wound are there. So important medicines we are covered today is that Arnica montana, Allium cepa, Bellispur, Calendula, Hypericum, Ledampal, Rostox, Cantharize, Symphatum, Hamamelis, and many more also. So that it is important, and these medicines are must in your kit or at your home so that we can heal the wound with homeopathy effectively. So first of all, calendula is important for the clean cut injuries, amputations, lacerated injuries there. So generally, the especially the calendula is a very known medicine in homeopathy that is used externally as well as internally, and it is also used in the it is known as a homeopathic antiseptic also. So it is must to kept home the calendula officialis always, so that it use both the way internal as well as external as in the tincture form. And it is also important to wash the wound also. And mostly clean cut injury or after amputation, if there pain is there, laceration during the labor, extraction of teeth is there, then there is a loss of soft tissues are there, can be union or cannot be union by adhesive plaster. There is a typical calendula having the sensation like exhausted from loss of blood and pain. In that case, the calendula is very, very important. And the rupture of muscles or tendons and post-surgical operations, labor, etc., to prevent excessive suppuration and disfiguring of scars. So, calendula having the role to promote the healthy granulation tissue or proliferation phase. So, we are seeing that all the stages of wound healing. So, the calendula helps to repair the wound very quickly and instantly in homeopathy. So, calendula is must to kept at home. It is also as an antiseptic is there in the homeopathy. Clean cut injuries के लिए important medicine is there calendula, and calendula is available in the ointment form also, in tincture form also, and potency also. So all these are there where you can use the calendula. It is also as a deep tissues wound. It is also prevent the scars if there's a wound is there. So if you apply the calendula, then uh, it stop the suppuration, and it stops the disfiguring, and the scars cannot form. It promotes the healthy granulation of tissues. And generally, the symptoms are worse in the cloudy weather, that is calendula is there. But calendula is very, very important medicine where you got that key. It causes the healthy granulation and rapid healing by the first intention is there. And if there is a hemostatic after the tooth extraction, and these all these are the important uh, of the calendula. And it is also used in the cancer as an intercurrent medicine also. So calendula having the most important medicine or the valuable medicine in Medica or in homeopathy. So it must be kept in your kit. The first remedy as a calendula. Next to calendula, we are having the belly spur, where the key words for the bellies to describe the bellies is stasis and fact. Actually, it is a medicine. It is known as also gardener's medicine in Medica, where you got the deeper tissue injuries after any surgical work, overwork, or overstraining of the muscles. It is also having the railway spine, that is the spinal cord is affected, where we got the strengthening of the spinal cord, spinal region, where autotraumatism is there. So in that cases, the belly spur is important. Generally, joints, nerve injury is also important in the belly spur. Location is generally pelvic region is affected, where you got a symptom or sensation like lameness of the joint, as if sprain, sore, bruise, swelling in the pelvic region, hard, aching, squeezing, and throbbing type of pain is there. Generally, spinal region is affected. So where there is a backache is there from overstraining and overexertion uh, is there, or from the fag or stasis is there, then Belisper is the medicine. So you can then it is also important medicine for the varicose veins, where you got the venous stasis, that already we see that it is a wounds where we got the varicose ulcers are there and varicose veins both, where we got the from long standing or due to the poor circulation is there. So in that case also belly spur is an important medicine. Generally, it is aggravated from touch because oversensitiveness to touch is there, and it is ameliorated or the symptoms are relieved after continued motion and cold application. Belly spur having also deeper tissue injuries are there, nerve injuries are there, where you got is there backache from overtaxation or overwork, where you got the people who are having the continuous backache. For example, the child is having the load of the bags, full bags is there, or the person's load where they loaded this too much in their back, and the long standing that heaviness on the back may cause the injury to the back muscles or spinal region. So in that case, belly spur is a very good medicine. Then Arnica montana. This is also one of the a very, very good medicine in homeopathic mathematica, where you got the bruises, abrasions that we know from the open wound, that is a blunt injury, or the bruises, abrasions, concealed injury. So injury by blow or fall, where we got the traumatic injury or the post-operative, pre-operative, both are there, where we got the arnica is the best medicine in Mathemedica, where we got the blow that is seen in the picture. If there's a blow is there on the eyes, injuries, extravasation of blood is there, blue black with extravasation of blood or the accumulation of blood is there, sore breast feeling all over the body is there, sensation, and there is a fear of being struck is there. Along with that, all the symptoms patient cannot bear to be touched because the injury is there, part is become after a bicycle ride or from fall from the bike or any accident where we got the abrasions and the bruises are there, then arnica is the very good medicine or the valuable medicine is there. It controls the hemorrhages. It is indicated in the both the types of wound, acute as well as chronic. It controls the hemorrhage. It reabsorbs the extravasation of blood, and that's why it prevents suppuration and septic conditions. So whenever there is a wound is there, so it are the chances if you are not maintain the hygiene, the maybe any reason is there or the dust is there, and the abrasions, bruises, they're having the chances of suppurative tendency is there. So arnica is given in the immediately if you given the arnica to the patients, then there is a healing is a very fast, rapid, and that prevents suppuration, prevents septic conditions, controls hemorrhage, so bleeding is stopped. It is like that hemostasis is there. So it having the power to stop the bleeding, and it having the great to is there. So recently, one case is also there where we got the head injury and bleeding is there, and immediately arnica is given to that patient and it stops the bleeding. So it is a wonder that arnica within 1 hour that stop the bleeding. So it having the hemostatic effect of arnica is there. So it is very good medicine. If we have must kept, it works in all potencies. Depends on the case. All potencies 30, 200, 1 m this is their arnica, so it must be must to kept in your first aid box the arnica montana. Generally the symptoms are aggravated from least touch. There is sensation is also there key everything on which because of the bruises and the abrasions, the sensation as if anything on the which patient lies seems to very hard, and he is always uh, restless in search of soft place. This is another characteristics for the arnica. Generally aggravation from least touch motion and from lying down on the soft place and rest causes amelioration. Leadenball, it is also very good medicine for the punctured injury. So it is again open wound punctured by nail, thorn. Then it is also known as anti-tetanus medicine in our Matra Medica. Sharp pointed instruments, nails, bites, rat bites, insect bites. Is there contagion of eyes and leads causing ecchymosis of leads and conjunctiva? Also, sensation of bruised and bitten is there. Thorn, punctured wound, bleeding is there. The long limiting discoloration after the blow is there, or the parts become blackish and greenish in discoloration part becomes where there is due to the blood accumulation is there. So in that case also, then it is also important medicine for the pain in the ankles as if sprained from false step. If there's a false step is there and that is having the sprain like sensation is there, tearing throbbing type of pain, it is also important for the ledum, which is also aggravated from motion, warmth of bed, and applying ice cold water on that injury is there, then it is important. Redampal is important for the both type of injury, also acute injury and chronic injury both. It is chronic in chronic injury if there is a discoloration remains for long lasting for years together, the discoloration remains or the there on the part. After that, that is the greenish and bluish discoloration occurs, ecchymosis occurs. Then Ledampal is the best medicine for that. It is also known as anti-tetanus medicine. So, if we are having the any iron is pricking or pin pricking is there due to that injury is there punctured. So the Ledampal is the medicine is there. Ledampal is also important medicine for the rheumatic people where they got the big joint affected and where they are also applying the ice cold water if relieved, then Ledampal is the medicine for that also. For the joint pain also it is a very good medicine. Ledampal is when we are talking about only the healing of wound, so it is also important medicine for the pimples also, where the small red pimples with slight pain is there, and in groups are there coming. So Ledampal is also treating the pimples also or acne also. Then hypericum, it is a nerve medicine. In there, nerve injury is the important injury of the hypericum where they cause a mechanical affection of the spinal cord, spinal confusion. Pain is there after fall and coccyx. Coccyx means lumbosacral region where you got the lower backache after the fall. Then this medicine is there. Also after the tooth extraction is there, so nerve affected. Or when there is, we are treating the tooth where we are having the RCTs, or if there is any injury to the nerve nearby, then hypericum is also very important medicine for that purpose. Also puncture wounds, lacerated wound, it is also one of the anti-tetanus remedy like a ledum, but here the nerve involvement is more in that rather than the ledum. Rat bites, injury from nails, lacerated wounds, it is a very important medicine for the lacerations, lacerated wounds. Puncture wounds are there, so hypericum is an important now medicine in Matra Medica. Injuries of part where reach into sentient nerves is there, is generally preserves the integrity of torn and lacerated tissues, prevent tetanus after traumatic injury. So if we are taking the TT injection, so instead of that TT injection, you can also take the hypericum 30 dose to prevent the tetanus after traumatic injury. Excessive painfulness because there is a nerve involvement is there, and it also preserves the integrity of torn and lacerated tissues. So from the torn tissues, it gets there is the integrates the torn tissues, and we can heal the wound fast, and there is no any further damage occurs to the skin and the tissues. So it prevents the damage to the tissues and torns, and it prevents like scars, and also any damage to the deeper tissues. It prevents the damage to the deeper tissues. So that is the great role of hypericum in that nerve injury, or where the nerve is involved in the injury is there. There is a pain is there also, along with the neuritis, with tingling is there, backache के लिए भी important medicine है. Generally cold damp causes aggravation, and bending head backwards causes amelioration is there in the hypericum. Then Rustox is a very also important medicine for sprain injury, where you got the sprain, mechanical injury, contusion, trauma. Joint and also muscles is the sphere of action of the Rustox generally, mostly the joint as well as the muscles, muscular injury, and generally seen the muscular injury in the sprains. So pain as if sprain and his muscles and tendons are torn, or it is also important medicine for the tendon injury and muscle injury, muscular pain, pain as if sprain, as if muscles are there. If you can apply Rustox ointment also, and you can take internally the Rustox also in that sprain. Okay. Then it is also having the affected area is inflamed, and it becomes hot. If the indications are there, we got the sprain of the muscles, where you got the swelling of the muscles, swelling of the joint, or if you get the redness and the affected part is hot, slightest feverish feeling is there, then Rustox is the medicine where you got the first move aggravation. It is also where the first movement aggravation and continued motion gives observation. Rainy weather aggravation is there, along with the feverish feeling is there, along with the injury. Inflammation stage is there. In that case, the Rustox is the medicine. So you can keep with the Rustox. Rustox is also act in all the potencies like 30, 200 and 1M. It is also important medicine for both conditions, acute as well as chronic. In the sprains, long lasting effects is there, or the any heavy lifting injury, back injuries there, history of fall on the back is there. All these purpose, the Rustox is a very good medicine, and it works in all potencies. It works in both the conditions, acute as well as chronic one. Then cantharides is another important medicine where we also talk about the burn injury. So for the burn, in the first degree burn or scars and the sunburn, the cantharides is a good medicine where you got a burning and raw sensation. It is important medicine for the blisters that you see in the picture. The cantharides, it is a very important medicine for the blisters. Then there is a burning and raw sensation is there, severe burning pain with itching and smarting. Then inflame with bleb formation, external application before or after blister formation. It is also used as external application. It also prevent vesication of skin. Burns, where we got the burning and raw sensation is there. It is also ameliorated from the cold application and aggravated from the touch. So cantharides is also important medicine where you got the scars and burn both. It is also important medicine for the sunburn, where you got the erythema, redness of the skin, and it is relieved after the application of cold water. Then cantharides is the medicine. Another medicine for the burn is also important, that is urticariase. That is also given in the first and second degree burn. Severe degree burn is there in the causticum, where you got the scar formations and the electric burns. And the patient also always seen that I will never since well been since the burns in causticum is the medicine for the chronic burns. So here some listed medicines are there like cantharides, arsenic album. Then the urticarians are important medicines. Picric acid also are the important medicine. We also see that four stages of burn: first degree, second degree, third degree, and fourth degree. So generally, we can heal with our homeopathy in the first 3 degrees of burns. with the wonderful medicines like cantharides, then like articaurines, arsenicum album, causticum. These are very, very, and picric acid also. These are the very good medicines for the burn injuries. Then Alimcepa is the medicine that is prepared from the onion. We know that we are using the onion in our day to day, but it is after potent digestion is a very wonderful medicine for the neuritis, phlebitis, that is the inflammation of veins, thrombophlebitis after the delivery, after forceps delivery. This Alimcepa is a very good medicine for the injury to the veins, that is the thrombophlebitis, that is the inflammation of veins. It is also important medicine for the rubbing injury, that is the after the friction injury, when we are having the shoe injury, when we are take the new shoes at home and where there is a rubbing is there, then it is also important medicine. Then after amputation, generally we are seeing the where the deep wounds are there, and if there is amputation is there, so in that case also, if there is a pain remains at the part of the amputation, amputate part after surgical amputation is the part of occurs, and if the pain remains at the amputate part or the neuralgia or nerve pain is there at that part, so LMCPA is a good medicine for that purpose. Only if you know the cause, then this medicine is there always with your hand to help this rubbing injury, shoe bite injury, or the after amputation, the nerve pain is there, then Alemcepa is the medicine. Where you got the glowing heat in the different parts of body, shooting pain is there, stinging or thread-like pain is there, and thrombophlebitis after the forceps delivery is there, that is the inflammation of veins, and very severe pain is there at that region, then Alemcepa is the medicine for that, which is also aggravated in the winning warm room and amputated from open air. These are the general modalities for the Alemcepa. Symphytum is known as orthopedic herbal medicine or homeopathic orthopedic medicine in our mathematical or homeopathy. It is important for the fracture of bone in the first stage. Fracture, eye injury, fall blows is there. Bones of eyes and periosteum is there. It is indicated for the first intention or the first stage healing of bone after the fracture, or it is also indicated where we got the at the fracture site if the pain is there along with the calcarea force to for the primary union of bones is there, symphytum is the best medicine. So along with we know that for the fracture of bones, immobilization of the bone or the joint is required, no doubt, but along with that immobilization, if you give the medicine like symphytum, it is a bone for bone. Symphytum is known as a bone for bone. It is also known as a homeopathic orthopedic medicine in our Mathemedica. So it is very important medicine for the fracture of bone. If you are giving this, the union of bone occur very rapidly, fast, primary union of bone, or if after the fracture also, if the pain remains at the place of the fracture, is you give the symphytum along with the calcarea force because calcium is required for the union of bones or the healing of the fracture. So symphytum along with calcarea force in biochemic you can give for the patient. So symphytum is also one of the important medicine. Where you got the bone fracture, also injury to the eyes or any bone part or fall or blows where peculiar pricking pain is there at the fracture of bone, or it facilitates union of fracture bone, that is by the primary intention, then it is favors production of callus, that is important to again to give the strengthening of the bone. It prevents the complications, that is the non-union of bones or malunion of bones. These are the fracture complications. After the fracture, the complications may occur like malunion of bones, non-union of bones, but it prevents that non-union of bones or malunion of bones. So always give symphytum in the fracture of bone in the first stage, so that it is again already said that it is a bone for the bones. So okay, so symphytum is also you have to kept with your in the listed of the your box, first aid box, that is symphytum. Then hemamelis is important for the capillary injury. So where you got the also lacerated or contused wound where we have the, it is also one of the important medicine as a hemostatic. It anywhere in the body, if there's an internal or external continuous bleeding is there, it is power to stop the bleeding at that time. Okay. And where you got the soreness of the bleeding part, passive hemorrhage, where the character of blood is dark in color, lacerated contusions or cause from fall, hemamelis is there. Again, it is aggravated from motion, moist air, touch, afternoon and open air. So, is there bone tissue? Already we seen millefolium is another important medicine where contusion or sprain that involves small broken blood vessels to bruise bleeding beneath the skin suggests the use of this remedy. It also often used blood for the nosebleed after injury. If there is a bleeding of the nose after injury or bleeding in other parts, for instance after childbirth or surgery, then millefolium is the medicine to stop the bleeding. So it is also act of the hemostasis static medicine. Then myristica is also another important medicine as a strong reputation as a great antiseptic power myristica for traumatic injury with suppuration. If the actually in the wound healing, if the diet you are taking properly along with the medicines, so healing is fast. But if any by reason any secondary infection in the wound is there, that leads to suppurative tendency where they will got the bacterial growth that like streptococcal infection or staphylococcus, and that leads to suppurative tendency. So myristica in the powder form or the myristica internally having the power to prevent the suppurative tendency after the traumatic injury. So it is also one of the, though it is a neglected, but it is a very good medicine, myristica. So you must also use this myristica medicine as a great antiseptic power is there in the myristica. Then another important medicine, though it is also one of the neglected medicine, the gunpowder, which is Dr. Dorothy Shepard pointed out in 1938 can cure as well as long been used as a treatment for suppurating wounds. According to the Shepherd, soldiers in the 19th century knew of it and took it in the form of mixed water, mixed in hot water. And it in homeopathic potency, then it is gunpowder, it is in form, the soldiers are used to heal the wound and having the in the suppurative, like deeper tissue injuries are there and where the bleeding is there and the deep injuries are there, in that case they are applying the gunpowder over that wound and that prevents the suppuration and that having the healing is there. So it is mixed with water, but after the in homeopathic preparation the gunpowder is very there, that is used in the 1x 2x powder for the infected wounds, abscesses, and it prevent the sepsis. So it prevent any wound for sepsis, septic, then gunpowder is used. So it is also one of the important medicine, though it is not used frequently, but it is also important medicine to prevent the septic condition. Okay. So these are all the homeopathic medicines that you should keep at your home so that it can use very effectively at our home. Every type of age patients are there, old age patients are there, then childs are there, they are also having day to day they are having so much injuries are there. So with homeopathy, if you are having the homeopathic kit at your home like arnica, bellis, calendula, at least ointment of calendula tincture you have to keep at your home, rustox, arnica, so that you can treat that small at your home with the homeopathy. And a great role of homeopathy is there in that all these wounds, and you can here with live happily with homeopathy and healthy with homeopathy. Thank you so much for listening me, and here from my side I end my topic. Thank you so much the Homeo BJN there for arranging such a webinar series and inviting me as a guest speaker in this webinar series. From I thank to the Parul University, management of Parul University, my college, my principal, my colleagues for their constant support, and special thank you to Alpesh sir as a moderator. Thank you so much.
Thank you so much, ma'am, for a wonderful session. It's very informative session for the students, for the homeopathy fraternity regarding the first aid, very basic topic, very important topic in routine clinical practice. If any have any questions, so please put in a question and answer sessions in your chat box so we can discuss here. One questions from Vikas Single. The question is: injuries are multiple. They occur. What are the medicines we should give to the patient in a homeopathic hospital or clinic? In a cross injury, crushed leg injury, what are the homeopathic medicines are there? The questions from Vikas Singhal.
Okay, thank you for asking this question. So, for crush injuries, according to that, calendula is the best medicine for the crush injury, and hypericum we are seeing because it is having the integrity and it having the integrity of the skin, and that prevents the torn of the skin also. So that is a very important medicine. So you can use the calendula as well as you can use the hypericum medicines for that type of crushed injuries, and it is having the great role is there also. I seen these deeper tissue injuries, and with only that dressing with calendula lotion, and internally you can give the constitutional medicine or you can give other medicines, so that it having the fast healing of these is there definitely that works.
Thank you, ma'am. One another question is there from Murali Krishna. What is the railway injury? What is the meaning of railway injury?
Actually, railway injury like that ki railway how the track of the railway is there, like that the spine is there. So that is flattening of the spine is there due to that over burden on the spinal region is there, and that becomes a that becomes very straight like that, and that is the important from the traumatic injury. So belly spur is there where we know that for the railway spine actually. That is given the adjective for that injury actually. That is not like a railway spine, but that is the state where you got the flattening of that vertebrae are there due to constant burden or the constant heavy weight on the back is there. That's why that injury occurs, and belly spur is the good medicine for that.
Okay. Thank you, ma'am. One last question is there, Dr. Ashish Kumar Nath. Remedy for CVA.
CVA, cardiovascular episode, or what you exactly mean? What that CVA? Or what
Uh,
exactly to mean CVA actually?
okay. Okay. Okay, ma'am. No more questions. The uh, Thank you all the participants putting different queries and questions here. So it's very informative session for to all the homeopathic students and homeopathic fraternity. Thank you so much. It's uh, privilege to today we have Dr. Mamta Tapas ma'am and deliver a very wonderful session. Thank you so much, all of you. Have a great day. Have a great uh, lecture. Goodbye. Good night. Thank you.
Thank you. Thank you so much.
Thank you, ma'am.
Can I leave? Can I leave?
Yes, ma'am.